It is Living Wellness Wednesday, and for today's segment, Dr. Ken Stewart, our good friend of KCU Joplin, is here to talk about stroke awareness and prevention. And I don't know if it's my age or what, but I have heard of so many people just within the past 30 days who have either undergone a stroke or they know someone who has had a stroke. And I'm sure this is something that upcoming doctors have to deal with a lot.
Yes, yes. Stroke is very commonly seen. Of course, there are two types of strokes. You know, when we're talking about stroke, we're talking basically about like a brain attack. If we think about a heart attack, it's the same thing. The brain is being denied oxygen to the brain. There's two major reasons why we have strokes. There's what's called an ischemic stroke, which is a stroke that basically disrupts the flow of blood and oxygen to the brain. But then there's also what's called a hemorrhagic stroke, which means, you know, usually a blood vessel will start to leak blood or will actually rupture and put pressure on the brain itself.
Okay, do both of those types of strokes have the same outcome? I mean, is a stroke, or do you treat each type of stroke differently?
So each type of stroke is treated differently. An obstructive stroke or an ischemic stroke is usually treated with something to try to remove the clot. It could be a plaque that ruptured, it could be a blood clot. That's actually the most common type of stroke too, the ischemic stroke. Hemorrhagic strokes in most cases are more dramatic and more catastrophic.
Is there a way to see this coming? I mean, if you are, what are you looking for a red flag that you may be on the precipice of a stroke?
Yeah, so that's really a good question, Gary. It's sudden onset, the sudden onset, and we use the acronym, everybody's familiar with FAST, which is
F-A-S-T.
Yeah, facial, arms, speech, and then immediately contacting somebody. So, you know, being able to, time is very crucial element, but I will tell you they're starting to use a new you know, kind of a approach to strokes, which is called B-FAST. And so the B stands for balance, and the E stands for your eyes. So we're talking about dizziness. We're talking about, you know, feeling clumsy when you're walking.
Right.
We're talking about visual disturbances like blurred vision, double vision, sudden blindness. Those are all big strokes. And then, of course, facial droop, if you've got a droop of the face, or having difficulty speaking because you've got a facial droop.
Right.
If you've got weakness on your arms, or usually one side is usually affected. And then, of course, we've got the speech. If somebody can't talk, or they've got slurred speech or garbled speech, or even if they're having a hard time interpreting speech, those are big red flags. And then you want to be able to call, if you think you're having anything like this, you want to dial 911 and get immediate assistance.
Don't even question it. Just go ahead and hit that 911.
Exactly, exactly. The other important thing I want to say, Gary, is that if you're having a stroke, don't try to drive yourself to the hospital.
Oh, which is where the 911 comes in.
Yes, exactly.
Okay, that is fantastic to know, and it's also, it makes me wonder if these things come on gradually, or can they come on just in the...
Usually suddenly.
So it can be sudden.
Yeah.
All right. And this is possibly the most important part of this entire segment, how to decrease your risk of strokes, because it may not be more prevalent, but more people are aware of this.
Yes, yes. And the fact that people are being educated on how to identify strokes when they're happening has really helped us to be able to identify them sooner. And the sooner we identify, the sooner we can treat. So they've got medications that will help dissolve the clots and get that perfusion back to the brain.
But we go right, if we can bring that last graphic up real quick, all of these things are things that you should probably be doing anyway throughout your life, because as we discussed before we came on, not only can this decrease your stroke risk, it's just going to generally keep your heart healthy, your blood, everything works better if you can just do all of the things that you're seeing on your screen.
Exactly. The one thing I'm not seeing on there is we do want to watch our salt intake too. Remember, strokes are usually associated with high blood pressure.
Right.
And you want to be able to keep that blood pressure down.
Okay, that's great. You guys at KCU, we love having you here. We're so excited about the grand opening of the dental school that's coming up very soon. We'll probably be talking about that in the next few weeks.
That sounds great, Gary. Thank you so much. I enjoyed being on here.
We love having you on.